This is Bianca. She has had chronic lower back pain, sciatica, and bursitis for the last 10 years, all thanks to a car accident in her early 20s. And even though she tried everything her doctors gave her, she still needed help getting dressed in the morning and couldn't even drive because she was too scared of her leg going numb. Now, I'm sure a lot of you are in a similar situation when it comes to your chronic pain, which is why I'm going to be showing you my simple game plan that I use to help her regain her independence in only 90 minutes. Adam here from trainingmassage.com. And the first thing we started with was 3 different kinds of assessments. The first one is for mobility, the second one is for her pain, and the third one is for her joints. And one of the first things we did was test her hip internal and external rotation, in which she only had really 5 degrees of internal rotation with about 10 to 15 degrees of external rotation, which leads me to believe she has some tighter glutes or muscles that pull the hips out, as opposed to your internal rotators. She even has some limited range of motion when it comes to hip flexion, roughly about 35 degrees, which indicates tight hamstrings, glutes, and maybe even the lower back. And when I tested her quad tightness, what I had her do was lie face down as I took her foot and try to bring it as close as I can to the glutes before she felt any stretch. But when I did this, she actually felt pain in her lower back. Now, what she should have felt was only a stretch in the quad. But because she felt pain in the lower back, that told me that quad was extremely tight, meaning it wasn't allowing the full range of motion, which began to pull on that pelvis, which then creates a kink and that pain in your lower back. Now, another test we did was a pain recreation test. What I had her do was lie flat on the table and just hang out there for about 30 to 60 seconds to see if that recreated her pain, and it did. I then had her plant her feet and bend her knees and stay in that position for another 30 to 60 seconds to see if that alleviated her pain, and it did. Now, what does this tell me? This told me that her lower back is probably tight, or her pelvis is getting shifted whenever she is laying flat or in a standing position as well. And this can be due most likely to a tight psoas muscle, or maybe even a tight rectus femoris, the quad muscle that we tested earlier. This is also why she feels better whenever she is in a seated position or when she had her knees bent. It's because the psoas and even the rectus femoris is now in a passively short position, meaning they're not pulling on the lower back or the pelvis. And the final test I did was to kind of just check her hip mobility, especially in the joints. And I did this by simply pushing her knee towards her chest to see what she felt. And for her, she began to feel a pinching sensation in the hips as I began to push forward. Now for me, this indicates tightness. It indicates that the hip is stuck in the socket, so the moment I begin to move it, it gets jammed into the pelvis, creating that pinch. So to test this and confirm this, I then created traction in her pelvis. And whenever I created the traction in her pelvis and then retested, she had no pain or no pinching, once again kind of confirming to myself that everything's tight and pulling that socket in, and it needs to get loosened up in order for there to be some sort of room for the hip to move. So now that I had an idea of what was going on with her body and what could be creating her pain, I now had a game plan for her massage that I'm about to share with you. Before we do that, make sure to hit that like and subscribe button. I am trying to hit 25,000 subscribers, so help me out by subscribing and sharing this video. All right, let's get into it. Now, we started off the massage by warming up the stomach for 1 to 2 minutes because I was about to get into the deeper muscles, the psoas. And again, the main reason why I want to target the psoas muscle is because she showed that she had pain laying down, which might indicate tight psoas. And again, she also had relief with the knees bent. So I want to target the psoas and another muscle later on that it can also be affected by this. And for the psoas muscle, I worked on it for about 10 minutes, including the iliacus, just focusing on really working on it and having her take big, deep breaths throughout the entire massage. Now, let me say this again. I worked on it for about 10 minutes each side. So just keep that in mind for whenever you are trying to get treated or if you're trying to treat yourself. From here, I moved down into the leg, into the other hip flexors like the rectus femoris. And again, for this one, I worked on it for about 10 minutes while also working on the other issues like the TFL and even the sartorius. And during my sessions here, I am simply, again, just trying to look for areas that feel irregular, that doesn't feel like the rest of the muscle, or areas that doesn't want to move with the rest of the body and just feel stuck. And again, I worked on the quads, the hip flexors in general for about 10 minutes on each side. Something to think about if you're going to be foam rolling your legs as well. Now next, I flipped her over like a pancake and began to work on her lower back, which is where her QL and her erectors are. Now, one of my favorite strategies for working on anyone in general is to help separate the muscle away from the bone or try to pull it away in general. Now, of course, you're not really ripping it away here, but by working on the tissues in between the muscles and the bones, you're going to allow the joints, especially here around the spine, to move independently, and you're going to allow the erectors to move by themselves as well without pulling on each other. Now, for Bianca's lower back, I simply worked on her spine, basically just trying to pull the erectors away from the spine or even just push the spine away from the erectors for about 2 minutes on each side. We then dove into the quadratus lumborum, also known as the QL. Now, when I went into the QL, I knew I had to work on there as well because those muscles were rock hard. And your muscles, if you didn't know, should not feel like a rock. They should not be hard and they should not reproduce pain. So what this told me was that these muscles are probably full of trigger points, or there is a lot of fascia restrictions in there, which has a lot of nerve endings and can also create a lot of pain. So I spent another about 8 minutes working on her QL, both sides, totaling 10 minutes on her lower back and her erectors. From here, I moved into her glutes and her hamstrings. And again, I'm doing this because she was missing more internal rotation versus external rotation, which means tighter glutes versus something like the adductors, which helps with the internal rotation. So with that, I pretty much started her off in a similar fashion I did with the lower back, but this time with the pelvis. Just like the spine, I cleared the pelvis from the glutes pretty much, what I have to call it, clear the line between the pelvis and the glutes, which allowed them to move independently without getting pulled by each other. Now, after clearing out the pelvis where the tailbone goes all the way through and all the way up and around, and then work directly on the glutes and the piriformis, because these are also muscles, especially the piriformis, can also create sciatica pain that shoots into the glutes and down the leg. And then from there, I worked on the hamstrings for about 1 to 2 minutes. These muscles were most likely stretched out considering the rectus femoris was shortened. And because of that, I only wanted to spend about 1 to 2 minutes still loosening the fascia around them so that the hamstrings can at least shorten properly as opposed to being stuck in that lengthened position. So altogether, we spent about 10 minutes on the glutes and the hamstrings. Once again, 10 minutes on each side to be more specific. Now, by this time, we were hitting about the 80-minute mark in her treatment, which means we had about 10 minutes left. And for me personally, I like to spend those last 10 minutes usually doing some kind of stretching. And the reason why is just because we release the tissue, release the fascia around the muscle. That doesn't mean that muscle is at its proper length. Take her rectus femoris, for example. We know the muscle is shortened to the point where she can't get full range of motion without the muscle pulling on the pelvis. So just because we loosen the fascia and maybe some trigger points in the muscle, that doesn't mean that muscle has lengthened yet. We just loosen the bags around it pretty much, which allows the muscle now to lengthen back to its proper length pretty much. So with that said, I went through and stretched out all the muscles that we worked on here. That includes the psoas muscles, the QL, her rectus femoris and her TFL, her glutes, and her hamstrings. And I did end up stretching each muscle for about 1 minute each. And the reason why, again, is because sometimes you need to allow that fascia still to stretch out. Just because it's loosened doesn't mean it's fully loose, and it might have to slide on top of each other still. So in this case, we're with 1 minute of stretching and holding that stretch while taking in big, deep breaths. we're going to allow not only the muscle to stretch, but also the fascia to stretch as well. And before I give you her reaction, I do want to be clear here that she was screaming bloody murder at me the entire time while I was working on her, because this shit is uncomfortable and it can be a little painful. And don't get me wrong, it was funny as hell. But she was threatening to choke me out right after that session. But after only a 90-minute torture session, all of her little anger and hate towards me turned into tears of joy because she was able to regain more than half of her mobility back and most of her pain instantly vanished. Let me just repeat that one more time. After only a single session of getting a real massage and not just an oily back rub, she was able to get dressed by herself and regain her independence. Now, if you are someone who lives in the southern San Diego area and you want to get some work done, then make sure to click on the link labeled application in the description below. But if you're not in my area and you still want to get rid of your back pain by yourself, then make sure to click on the video up in this corner. I'll see you over there.